If we look at the places that audiologists are found, it defines some of the things we do. Audiology is at the base a diagnostic profession. We do diagnostic testing. We go looking after answers of what's wrong with the person's hearing. I think audiologists are often thought of as people who just deal with hearing aids, which is part of what we do, but that is a treatment. What we're really after is finding out the answer of what's going on with someone's ears or balance, depending on what the person's problem is. So in a sense, audiologists are investigators. We look at the whole person. We even look beyond the person into their social structure, what their jobs are, what their communication demands are. The high school football player with a hearing loss is going to have much different needs than a grandmother trying to hear her grandchildren. And every person is a little puzzle, and it's our job to figure out what that puzzle is. Is there something that can be done on the medical side that can prevent the hearing loss? Is there something that can be done to slow the progression? We need that sort of information from our ear, nose, throat colleagues. If there's nothing that can be done, what can we do? One of the very first things that people with hearing loss will often do is to comment on the others who are mumbling. So at the front of a hearing loss, we start hearing words like, people are mumbling, someone's running the TV too loud, the family members are joking about selective hearing loss. Sometimes you'll also see some people withdrawing socially. That may happen a little later on, but social isolation goes hand in hand with hearing loss. If you've got hearing problems, audiologists are in a unique position to evaluate and to set the gears in motion to get the basic diagnosis of what's going on with your ears and to lay out for you a plan of action. The plan of action may be intervention from the ear, nose, throat physicians. It may be do nothing right now, come back and be checked in a year. It may be counseling with families to tell them how they can better communicate with you so that you can hear better. It may be counseling on hearing conservation methods. Those are some of the tools we use in dealing with the problems of hearing loss. If someone needs a hearing aid to deal with the hearing loss, we'll set up a management plan to deal with the hearing aid in an ongoing basis, not as just a one-time purchase. As an audiologist, it has been a wonderful advantage for most of my career to be coupled with ENT physicians. The reason I like this is because it gives the patient access to every part of the hearing healthcare team. Having access to speech-language pathology here, the allergy clinic, we do some imaging studies here. We have the tools here to look at the whole range of things that can cause hearing loss. If it's a patient that has a significant hearing loss that is not medically treatable, the audiologists get to step in and do our things with hearing conservation, working with families, working with hearing aids, working with assistive listening devices, working with special communication techniques, whatever is needed for that patient. That's where we shine.